Each year, Medicare provides more than 60 million Americans with health insurance coverage. While Medicare costs can add up fast depending on someone's unique needs, it is a myth that it is unaffordable or is always more expensive than other forms of healthcare. In fact, many people are surprised to discover that Medicare can lower their medical expenses. Interested in learning more? I'm Matt Rice, Assistant Vice President of Strategic Growth Initiatives, and in this video, I will help define some important Medicare terms and break down some of the common Medicare cost structures to help you learn what you may expect to pay for Medicare. Before we jump in, there are several terms you should be familiar with, as each will play a role in determining your healthcare expenses. The first one is premium. A premium is a fixed monthly amount a beneficiary pays to have Medicare coverage, whether they utilize services or not. Next is deductible. A deductible is the amount a beneficiary must pay for Medicare-covered items or services before Medicare will begin covering its share of the costs. Next up is coinsurance. Not to be confused with copayment, coinsurance is the percentage of the cost of a Medicare-covered item or service for which you would be responsible after the deductible is met. Lastly is copayment. A copayment is a fixed amount the beneficiary must pay for a Medicare-covered service or item, like many people pay at each visit for specialty services like physical therapy. Now that we have covered some basics that can help you more confidently navigate Medicare costs, we will move on to the different parts of Medicare. Understanding these is key to determining what Medicare selections may best suit your unique financial and medical needs. So let's begin with Medicare Part A, or hospital insurance. This covers inpatient hospital care, skilled nursing facility care, hospice care, and some home health care. Most people get Part A without premiums unless they or their spouse did not pay Medicare taxes while working. But it's not cost-free since Part A coverage includes deductibles and copayments, which can quickly add up during a hospital stay. Next is Medicare Part B, or medical insurance, which covers outpatient doctor visits, visits with healthcare providers, home health care, durable medical equipment, and some preventative services. While only a small deductible is associated with Part B, all beneficiaries also pay a monthly premium, and most items and services require coinsurance. Next on the list is Medicare Part C, or Medicare Advantage. These plans are offered by private insurance companies approved by Medicare to administer Parts A and B, and sometimes prescription drug coverage. How much you pay for Medicare Part C depends on the type of coverage you choose. Premiums can start at $0 per month, and out-of-pocket maximums can go as high as $8,850 per year. Most Medicare Advantage plans set reasonable caps on out-of-pocket expenses, known as max out-of-pocket protection. Next is Medicare Part D, or prescription drug coverage. This is also offered through private insurance companies and helps cover prescription drug costs. Like Medicare Advantage, Part D costs will vary depending on the plan you choose and the availability and class of the drugs you need. On average, Part D premiums hover at around $35 per month. Finally, you may also choose a Medicare Supplement Plan, or Medigap, which can help you reduce out-of-pocket costs for services that fall under Medicare Part A and Part B by having your Medicare plan pay a larger share of coinsurance, deductibles, and copayment costs. To better understand if a Medigap plan may be the right choice for you, we encourage you to speak with a trusted professional from our team. This can be a complex decision, and we know what questions to ask to help you find coverage options that meet your unique healthcare and financial needs. Making the right Medicare choice is important, and you don't have to do it alone. Call AVO at 877-406-5160 or contact us at avoservices.com. Our licensed agents are experienced and equipped to help you navigate Medicare costs and coverage options until you feel confident in your decision making. We are here to help.